right, if you guys are ready to start. Yeah. Okay. Well, good evening, everyone. Welcome to our first bonus session, Family and Career Balance. As always, as our regular sessions, we will post this recording on our YouTube channel, Pre-Health Virtual Shadowing. So if you have to leave early, it'll be on our YouTube channel shortly. If you have any questions regarding our regular sessions, please feel free to contact us at virtualshadowing@gmail.com or on our Instagram at virtualshadowing. Can you go to the next slide, please? Now, this is a bonus session, so it's going to be a little bit different from our regular programming. First, this is not for credit, so there will be no assessment or a certificate at the end of the session. Secondly, we will only have one Q&A, so if you have any questions for any of our panelists, please put it in the Zoom chat, and the team and I will be working on those questions to give out during the Q&A. And lastly, this session will only last an hour instead of our regular 1.5 to 2 hour sessions, but it'll still be a fun time. Next slide, please. I would like to introduce our lovely panel for the evening. First, we have Dr. Robin Novakovic. You guys might have seen her on our Specialty Spotlight Radiology and Neurology. She also has her son, Sava, joining us tonight. We have Dr. Brandon Morchetti, who not only presented at SWAT and Tactical Medicine session, but he's also been part of our physician team for about 30 sessions now, so he's been a familiar face. And joining Dr. Morchetti, we have his lovely daughter, Chloe, and his better half, Mrs. Morchetti. So please give a warm welcome to all of our panelists in the chat, please. And Dr. Morchetti, can you take it away?
All right, will do. So thanks for joining us on this bonus session, guys. This is kind of a unique niche of a talk. It's something that we notice you guys ask about a lot every week, and we wanted to make sure to be able to give you a dedicated session on this type of topic. So y'all know me. I'm going to tell you how not to do things, and then Dr. Novakovic will tell you the better way to do them. So first, to start with kind of my 20-year story here, so kind of the mishaps along the way. So 1999, graduated high school and started college. And for those of you who are trying to do the math real quick, that makes me 39. I started college. I didn't want to necessarily be a doctor. I was thinking maybe some sort of health career. I didn't come from a family of physicians. I played baseball. I knew about physical therapy. That sounded pretty cool. So I figured maybe I would just be a physical therapist. Didn't really put much more thought into it than that. And also that same year, began dating this girl named Teresa. And then I just focused on some undergraduate work and geared towards physical therapy. And in September of 2001, as it rocked many people's worlds, it did mine as well. And it kind of set my path in a different direction that I didn't really realize at the time. But all I knew at that moment was, yeah, sure, I'm going to stick with physical therapy, but I wanted to do something else. I felt called to be a first responder, and I marched down to my local fire department and became a fireman and EMT school, and graduated EMT school a few months later. And also at that same time, this was still an undergrad, I married Teresa, probably in retrospect, a little too young, but it was the decision we made at the time. And while still an undergrad, began working on an ambulance. And that's what that red line indicates as my career in EMS. And then I kept working in my undergrad curriculum. And in 2003, got my bachelor's in health sciences and then started physical therapy school. So I liked working on the ambulance. It was okay money, not great, but I kept doing it. And because I enjoyed that work, I wanted to learn how to do more. So I went to paramedic school at night while doing physical therapy school during the day. And then I became a paramedic, kept working on that same ambulance, kept finishing PT school, and then graduated from PT school in 2006 and started that career. And that's the green line there. But I really liked working on the ambulance. So I kept doing it part-time. Just a few shifts a month, not too much. So there's that red line, kept on going. And I thought, cool, great. I got 1.5 jobs. I got a degree. Money's good. I'm going to have a ton of money, except about 4 months after starting that job, my son was born. And so I just went right back into poverty where I'd lived before because kids are expensive. And those of you who have them know this. So I, um, I enjoyed working as a PT, and it was rewarding work, but I really, really liked working on the ambulance. I liked the patient population. It was exciting. They were real sick. There was critical care and resuscitation. I got to make a real difference immediately. And I think that kind of appealed to my nature of wanting, quicker results than maybe I got as a PT. And my brother he was in medical school the same time I was in PT school. So he convinced me to go back to medical school to be an ER doctor. So I applied in the next year. And also late that year, my daughter, Elena, was born. And a few months later, I found out I did not get into medical school. And I was crushed. That was my first real failure that I had not experienced up to that point. And I got to debrief I only applied to one school. I didn't want to move. And so I didn't really give myself the best chances of success there. But that one school told me, good job on GPA and having a doctorate degree and your own clinic and this autonomous practice and your letters of recommendation, blah, blah, blah. But my MCAT was terrible. So they said, no, you can't come in here with that MCAT score. So I was crushed, but still had resolve to continue on. So I applied again later that year. I studied harder. I did much better on the MCAT. And then in early 2010, I found out that I got in accidentally. And then in August, I started school at the University of Arkansas for medical sciences for an MD program. And because you're starting school, you can't really keep working full time. That's ridiculous. But at the time, my wife was a stay-at-home mom, and she had to go back to work, and kids had to go to daycare, and I was going to have to take out loans, and we still had bills, and I kind of felt guilty, and I wanted to keep contributing to the finances. So I kept working part-time, not just one job, but both jobs. I would do 2 weekends a month as a physical therapist in the hospital and at least 2 night shifts a week on the ambulance during the majority of medical school. And that sucked. That was horrible. It was stressful. I was tired, pushing 36, 40-hour days, at least a couple of days a week. Looking back in retrospect in the marriage, there was some animosity and bitterness about me going back to medical school and kind of changing the life plans that we had. There was stress, and one argument led to multiple arguments, and it all kind of came to a head in a couple of years because the foundation was not great to begin with, and then you enter into such a challenging curriculum. And in 2013, I got divorced, and that was a really challenging time. The timing was terrible, to be in medical school when that happens, let alone such a major life event. But it is what it is. You learn from it. You move on. Looking back, we, at this point, several years later, we're friends now. We're both good parents. We get along. We're co-parenting, and life is good. But at the time, in 2013, that sucked. So I put my head down and I was like, I'm not going to quit medical school. Keep going. I'm halfway through it, and finished up third year into fourth year. Getting close to graduation. And ironically, in 2013, I don't know what it was about that year. I made a 4.0, whereas I had been struggling before that considerably. So something lit a fire under me. And in 2014, as I was trying to make a new life for myself and had a little apartment, I would always go study at this Starbucks close by, and got to know the baristas real well. And I met Diana, and started out with a wink and a smile, and then some free coffee. And she had a degree in biochemistry and had also thought about medical school. And so she knew I was in medical school. That's how we got to talking initially. And, we started dating, and, one thing led to another. And then I matched into residency out of state in Dallas. And even though we had been together for several months at that point, we had kind of a life decision to make. And so I did what any self-respecting 33, however old I was, year-old man would do. And I married the woman and dragged her down to Dallas with me, because I knew what I wanted. She was a great partner, very supportive. And, I was moving to a different city and different state. And we powered through residency together, blood, sweat, and tears. But we did it. It went by in the blink of an eye. My intern year, Chloe was born. Chloe, say hi. She's hiding behind the chair. And then we powered through a couple more years. I graduated in 2017 from residency and started my fellowship. I passed my boards in November. And that same month, that same week, as a matter of fact, that I took boards is when Emma was born. Emma just got spanked and put to bed. So y'all won't get to meet her tonight. She's had a rough day. She's 3 now and independent, if you know what I mean. And then I started fellowship. I graduated fellowship in the summer of 2018 and stayed on as faculty here in Dallas at UT Southwestern, passed my EMS board in 2019. And I thought, cool, 20 years later, here I am, finally goals achieved. Let's lay back, chill, autopilot. I got a good job. I got an amazing job. Life is good. And I'm just going to sit back and enjoy it. And then the world's worst pandemic happened. And I'm tired. Y'all, I'm very tired now. I should have became an architect. So here's my current roles. There's a lot. I am currently on faculty at UT Southwestern in the Department of Emergency Medicine. I am the attending physician at Parkland, the busiest ER in the country for the last 2 years running. I'm the associate division chief under Dr. Fowler for the division of EMS. I'm the number 2 medical director for the 9th largest fire department in the country and the number 2 medical director for overall the 5th largest EMS system in the country. I'm one of the assistant medical directors for the police department and the SWAT team, and also a reserve specialist and a tactical doc on that same SWAT team. Occasionally, I get to serve for the Texas Department of Public Safety. That's our state troopers here. Department of Homeland Security, ATF, DEA, FBI, Secret Service, and don't ask how any of that is going right now. I get to be the team emergency doc, one of the team docs for the NHL Dallas Stars, which I don't even like hockey or being cold, but it's a fun sport to watch from the bench with them. And then the co-director for both the Tactical EMS Fellowship and the regular EMS Fellowship. And that's just me teaching those who want to do the same thing that I do, other doctors who want to do this. And then my way of giving back is as the course director for the first year medical students, teaching them how to be EMT basics, because I felt like that career gave me so much and set me on this path. But my most important role here is that of a husband to Diana and a father. And not always the best at it. And it's a daily battle. It's a struggle that I have to stay very disciplined on. But to me, it's the most important role. So, when you're sitting in the chair that y'all are sitting in right now, and you think, if I can just get to that next step, if I can just accomplish this goal, and you think that the grass is always greener and beyond that next step, and it's, rainbows and unicorns and puppies, I don't want to burst your bubble. I just want to set realistic expectations that is not the case, that each step brings new challenges and new obstacles. And if you are not prepared for it, they can catch you off guard and increase your risk of failure with it. So I want you guys to be smarter than I was and be prepared for those steps as they come. So with the specific challenges and obstacles and failures in my part, obviously there's the part about not getting into medical school the first time. And you know what, that sucked at the time, but looking back, it's fine. It's okay. Turns out, I believe everything happens for a reason, and that if I would have got into that class, I think life would not have been the same. And in the class that I did get into, such a good support structure with the most number of married couples and parents in that medical school class than any other class that they had up to that point. So I was blessed to be in that class that I got into. Obviously, the failed marriage during medical school, talked about that already. We both learned from that and moved on. I think we're both better people and better parents as a result of that. Financial problems will always lead to added stressors. So, in my case, I was working 2 jobs during medical school. There wasn't a single other person in my 174 student class that had a job, let alone 2. And in retrospect, I should have just got more student loans. There was no need to put that much stress and burden on me. It was fun or good, I guess, to be able to work in a healthcare setting while in medical school, so I could have some sort of context for my lessons to, patient care and stuff. But that was just nonsense. That was time that I should have spent, with family or being a dad or studying or anything else other than working. And then I didn't bring this up yet, but my first year out in practice, I had a really challenging case with a 4-year-old that I misdiagnosed, and she died, and I was sued. And that was horrible. That was the worst thing I've ever gone through in my life. I never want to do that again. I learned so much from that case. That's a whole nother lecture in itself that one day I hope to have the courage to be able to teach others about that one. But right now that still drums up more emotion than I even want to talk about right now. I have a pathologic desire to want to help everyone and fix everything, along with a difficulty in saying no. Those 2 things absolutely lead to increased burnout and stress. And, the field of medicine, the business of medicine, absolutely exploits physicians' altruism and takes advantage of it. And this field will suck the life out of you. This profession that you give so much to will not give back to you to the same degree that you give to it. And so you have to be cognizant of that and aware when you are depleting your tank, and it will affect your patient care, your patient interactions. I feel myself getting a bit testy with patients, with less patience with them when it comes to maybe adherence to regimens and things like that. So you just have to have good emotional intelligence to be aware of that. And then this year, unlike any other, has been an assault on the field of medicine. I think that the time has long passed where physicians are seen as experts in their particular areas of specialty, or as leaders in science or evidence-based medicine. And this year, everything we do is called into question. The pandemic is a hoax. Vaccines are just a way to insert 5G microchips. I get paid more money for every COVID diagnosis I made. I wish that was true. My wife wishes that was true, but it's not. And, you can't fix that type of mindset. And this year, on top of all the work we're doing, all the stress, I personally got sick with COVID and had a very rough go at it, trying to help out patients, and what I do with public health, and my Dallas County with 3 million people in it, trying to help keep the community safe here. To be assaulted like that, it further depletes the emotional tank. So my last slide here, to me, this is my words of wisdom to you guys. So to me, medical school is way more about your work ethic than your IQ. I am not the brightest crown in the box. I was stand by my GoPro died. Let me switch over to the computer. Okay, sorry, I had a GoPro camera that was had a much better screenshot than. All right, so I made up for my lack of intelligence by just working really, really hard. And I feel like that's probably the norm. That's probably most people. And so just be aware if you're struggling with, I don't feel like I'm that smart, my grades aren't that good. I promise you, you'll be surrounded by people just like you. Just no one wants to admit it. So just keep your head down and work hard. It takes more than book smarts to be a good doctor. So, if you work hard and you make good grades or you don't make good grades, it doesn't matter. What matters is that you're kind and compassionate and professional, and you're empathetic to patients, that you know how to communicate, and you don't talk down to your patients. You don't stand over their bed towering with your arms folded and look down your nose at them and think you're better than them. you guys are on these forums and these blogs and Student Doctor Network, and you see how rude and hateful some of these other students are. Just know that they will not survive through the rigors of training that it takes to get to where Dr. Novakovich and I have gotten to. This profession will cannibalize those types of people. So you either adapt or you don't make it. So those of you, just be who you are, be true to yourself, be kind, and you will make a fantastic physician, even if you don't know all the answers for how to take care of your patient. Number 3, I firmly believe that students with families make better students. It's because you're used to the structure and routine and discipline and compromise, and you don't have time for nonsense. You're not going to go out partying on the weekends. You know how to be efficient with your time because you don't have much of it. And so I'm a firm believer that those of you right now, with spouses, significant others, with children that are really worried about this, don't be worried. The habits that you've learned up to this point to make you successful are going to continue to keep you successful as a student in a graduate level program. Number 4, the only way you don't achieve your goals is to give up. That doesn't really require much more explanation other than that. Number 5, it's okay to fail. And not only that, the failures are inevitable, not only in medicine, but in life. And so just expect it and reframe it when it does happen. Think of it as just a temporary challenge and a way to help you grow. And I believe that if you're sitting there going, well, I haven't really failed yet, I've been successful with everything that I've done, then that's because you haven't challenged yourself enough. And so if you haven't experienced failure up till now, you need to expand your experiences until you do fail now, because you need to learn how to overcome that now before you get into something like medical school. And then medicine should not be your sole focus in life. And I'm waiting on my wife to kick me under the desk here on this bullet point. But like I said before, you can give so much to this field that does not give the same back to you. And you just have to be aware of it, that you need to have other extracurriculars and hobbies and things like that that help to reinvigorate you and just get you away from this field. And that's true for no matter what job you do in life. Have something else on the side. And then the final bullet point here is, even if you have to schedule time with your family, then do it. Make it a habit. For me, I try to block off every Friday evening and Saturday with my family. It's not always successful. There's assaults on my time, occasionally, but I make that a habit and try not to break that date with my family. And I think that goes a long way to help with balance in the long run. So that's all I had for my part. And, y'all can ask questions on here. I see questions in the chat. We'll get to, y'all can hit me up on Twitter or DM if you want to. And then I just put these pictures here to show that I have a really cool job, a fun job, and I get to practice a lot of my specialty outside of the walls of the ER. To me, I think there's no other job like it. So you guys are in for a great field.
Thank you, Dr. Morchetti, for your words of wisdom. Before we move on to Dr. Novakovich's section, we actually have a couple questions for Mrs. Morchetti. Hello. First, what was the hardest part about supporting Dr. Morchetti in the medical field?
So residency was hard, as he mentioned, but it's something that we mentally prepared for, and we knew that it was going to be hard. So I think I took it day by day at that point, and I was working, I was keeping myself distracted as far as that goes. And then lately with the pandemic, it doesn't help much, but it really is hard to support him when I see him working as hard as he does. And others just don't appreciate it as much. So I'm still working on that, on supporting him there. But I think that's probably the biggest struggle that I have with that, when I see him losing family time and just working so much.
Yeah, understandable.
But I know, like he said, there's so many others in the community that really need it right now, and day by day.
What has worked in your family balance and what hasn't worked?
Scheduling is hard. I thought that there would be a little bit more consistency with his schedule, but this last year kind of threw it all off, where he's on call a lot. If someone needs him, he's the phone is tied to his hip. So I just try to be really understanding with that, as far as losing a lot of what I would think family time for us. But so that I think hasn't worked. But like he mentioned before, when he does schedule, I'm not very good at planning either. So if I don't tell him, take this time off, sometimes he won't. So I tell him, I'm like, you need to take the initiative and block some time off. When we don't, that's when it's harder, because then I get frustrated and he gets frustrated, and then
and there's yelling, and we don't want yelling.
Yeah, or the blaming game, but it's day by day.
Mm-hmm. Cool. We have a question. Do you have family to support you and your children with y'all's busy schedules?
I'm not sure Brandon had mentioned this in his talk. We moved out of state. We're originally from California, and he's from Arkansas. So a lot of my family's back in California, and his are in Arkansas. So no, and I would probably recommend on having that support for those that, either plan on starting a family in medicine or moving back, but that just was not in the cards for us. So that has been very difficult. I think it would be a lot easier if I had, I needed me time, call the in-laws and take the girls. I got to run to the store alone.
Yeah, a lot of my colleagues that have grandparents that live around here, it's so easy for them to drop their kids off for a weekend. We got nobody within 5 hours of us.
Oh, no.
Yeah, kind of out here on an island in a city of 3 million people.
And lastly, before we move on, do you have any advice for any others in your position of supporting someone in the medical field?
Day by day, I think it's really important for them to take, as a parent or as a significant other of a physician, especially with what's going around us in today's day, is just to take time for yourself. You really need to be okay in the situation that you're in, and then kind of a big picture, and remind yourself that it is kind of short-lived, although it's hard to tell ourselves that these days. It will pass quickly, just like residency. I remember in the middle of it all, there were days where Brandon would work until midnight, and I would go to bed, not to bed, I would go to work, and we would, see each other for an hour, and it would go on like that for 2 weeks. But it's over. So we're hoping that quickly this time will pass as well, and then he'll have a lot more home time.
All right.
That's a better answer. I thought she was going to tell y'all to get out, change specialties, don't do medicine. So I'm glad she didn't say that.
I saw someone mention go into architecture, and then another student was like, don't do that. Don't do that.
Well, thank you so much for giving us your honesty. A lot of the students are grateful for, showing us what's really like to balance family. And next, can we have Dr. Novakovic give a little bit about her family life balance?
Hey, and while you guys are dropping questions in the chat, put them in the big chat rather than direct message, because the team is compiling them so we can do a Q&A session at the end. So sorry if I don't respond to those who are doing direct messages.
Yeah, and we also might go a little bit over time, so to answer all y'all's questions. So Dr. Novakovic?
Well, thank you. So I am Dr. Novakovic, Robin Novakovic, and I was asked to give a talk on balancing life and family and career. And I thought, you have to address the elephant in the room, which Dr. Machete touched on somewhat, And that is also thinking about physician burnout, because the more aware you are of it, the more you can try and help find strategies to minimize that effect and the impact that it has on your life. So these are my disclosures. Number one, I'm a mother of 3. I am a physician. At times, I too get stressed out and exhausted. I make mistakes. We all do. It is a part of life. At times, I'll also struggle to find the balance in life. And at times, I can feel like life is this marathon of treading water. And the best I can ever hope for is that I can keep from drowning. And simply because I give this talk, it doesn't mean that I'm always successful at balancing life. There are times that I struggle. But now that you know all of this about me, would I change my decision for what I chose in life? Would I pick a different career if I could start all over? And actually, no, I would do exactly what I have chosen. And so would I pick the same career? Yes, I would. So my journey started with 4 years of college. And in that 4 years, about my junior year, I got married. When I finished college, I actually became pregnant. So I had a gap year where I gave birth to my first son. And then I started medical school. And because medical school can be very difficult in and of itself, when you start adding children, you recognize that, it's going to take a little bit of a greater balance than it would for someone who doesn't have family. And so I made the decision to take that first year and actually split it in 2. So medical school really took 5 years for me. And that was so that I could have a little bit more time knowing, being a new mom, that I might have some more challenges in trying to meet the demands of medical school. So I did want to point out that is an option in some medical schools where you can take the first year and split it in 2. And so your total time would be 5. Now, residency for the profession that I do, as I had pointed out in my last talk, there are 2 ways that you can go about it: neurosurgery, radiology. And what I chose is to do neurology. And so my residency was 4 years. And then I had to do subspecialty training called a fellowship in neurocritical care for 2 years. And then I did an additional 2 years in neuroendovascular. And that's the training I went about in order to become a neuroendovascular surgeon. So as I mentioned, I started out medical school and my son was 9 months old. And so I did medical school in Chicago, where I grew up at Rush. I did my prelim year for my residency at Rush as well. And then I moved on to University of Chicago to complete my neurology residency. And in my neurology residency, I had my second child. And surprising and shocking, a lot of people in our program, I actually had a third child. And what I found out when I was at University of Chicago is I was actually one of the first residents to actually have a pregnancy during any residency within that program. And it added some challenges trying to determine, what do you do with maternity leave? How do I make it up at the end? With my third pregnancy, I actually went into preterm labor, so I had to go off on medical leave. And so it added some challenges that I'm happy, to talk more about if someone had questions, but it did add a little bit more challenge to my residency. I did then go on and do my my neurocritical care fellowship there at University of Chicago. And then I transferred and moved the whole family down to Texas to do my interventional fellowship. And as I mentioned, that was 2 years. And so by the time I completed that fellowship, I too found that I was in a divorce. And so that marriage ended at the end of my last fellowship, right before I became an attending. And I suddenly found myself being a single mother of 3 children and starting a professional career. So I thought it might be important in my part of the lecture to really focus on, again, what are some of the things that we can do to recognize the challenges, the pitfalls of becoming a physician. And then also we can focus on what are some of the coping strategies to help us be successful. So as you've heard, really trying to do any profession in life is going to be a balance. It's going to be a balance between family and our careers. And we may naively think that when we start out, we're going to easily be successful in all the things that we pursue. But actually, we're going to learn as we go in life and through this talk, and as you heard with Dr. Moschetti, that life has challenges to it, right? We have our personal goals, and we're going to have stressors from our personal goals to our professional goals. There's financial stresses. We have marriages, relationships, children. We have even simple things like laundry, housekeeping, homework. There's lots of stresses that we can feel in our life. And even that can include trying to find the right amount of sleep so that we can be coherent when we're working or talking with others. And so in life, we will have successes. And you know what? We will have failures, because failures are a part of life for everyone. And sometimes we even face mood disorders, either for ourselves or our family members, facing depression. And we have to be able to find the ways to cope with this, to learn how to ask for help and how to balance all of these challenges in life. So I often liken my life to having a bunch of plates spinning, because people always ask, how did you raise 3 children and have a demanding professional career? And so I always give the analogy of multiple plates in front of you spinning. And at some points, you're going to have to divert your attention away from certain plates to keep spinning others. And so, there are times that we will be successful, but there are times where a plate is going to drop. And there will be times where we accomplish all of these plates in the most spectacular way and achieve things that we are just far better or greater than what our expectation was. And so you have to have faith that you can get through this, even though you might face challenges in life. So I mentioned physician burnout because this is something really important in a field of medicine, and I want to talk to you a little bit more about what it is. So burnout is a state of emotional, physical, and mental exhaustion. It's due to excessive and prolonged stress, and it can affect happiness, our relationship, our career satisfaction, and even patient care. Burnout has been described as long-term job-related stress that leads to exhaustion, cynicism, feeling detached from the job responsibility, and a lack of sense of personal accomplishment. And I can tell you, these are very real. We feel these intermittently throughout our careers. It's how much we allow them to impact us, you'll see, is how negative burnout can be if you let it overwhelm you. So physician burnout, we always talk about it really encompassing 3 domains. Emotional exhaustion, which is this loss of interest and enthusiasm for practice, and a depersonalization. This was described to you. It's where you have this poor attitude with cynicism and treating patients as objects. And that happens. And this is part of a sign of burnout that you can see. And also career dissatisfaction, a diminished sense of personal accomplishment and low self-value can also be signs of burnout. In a study that took place in 2015, they found that burnout really was escalating and increasing among physicians. It went from 45.5% to over 54% from 2011 and 2014. And in 2014, I think is really of the time where we started to become aware of the term burnout and what its impact had on our careers, our lives, our personal lives as well. And so in 2012, an Archives of Internal Medicine actually found that US physicians suffer from more burnout than any other worker in the United States. And while that was 2012, that same finding was echoed in a study that Forbes put out just this year. And medicine was the #1 specialty that could be impacted by burnout. So in 2020, it's changing, right? So we become more aware of physician burnout in 2014, and we start to implement things to try and help alleviate the effects of burnout. And perhaps that's why in 2020, we're actually seeing burnout decreasing. And I'm wondering too, if some of this has to do with the effects of the pandemic and people working remotely, working from home, doing more meetings via Zoom. I haven't gone to an annual meeting in a different location and traveled all year. So I know I'm staying home more. And I wonder if what we will find is our physicians suffering less burnout as a result of the pandemic. So that's to be seen. It's something I wonder about. But in 2020, we are seeing that it's decreasing to 42% compared to 46% over the last 5 years. Now, certain specialties do have higher rates of burnout. And over 5 years, the specialties that most consecutively are included in the top tiers of burnout include critical care, emergency medicine, family medicine, internal medicine, neurology, and urology. And actually what's interesting is neurology has hit the top 2 for the last few years repeatedly. And in a Medscape survey that they did just this year, neurology again was #2. Remember, that is by specialty. So American Academy of Neurology actually did a survey back in 2014 when they started to recognize that neurology was being singled out as one of these fields that had a high level of burnout. And they asked in this survey, what were the factors that were contributing to burnout? And what they found is a loss of patient-physician relationship, loss of professional autonomy, requirements to perform meaningless activities to meet documentation standards, meaningful use criteria, and even quality measures mandated by payers were some of the factors that were contributing to burnout amongst neurologists. And there is a physician author who actually wrote a good book, Learned Mindfulness, Physician Engagement, who found that the leading cause of burnout in physicians is really attributable to administrative burden. It's this driver that in the workplace and organizational culture that is creating this impact, this factor that's leading to burnout amongst physicians. So physicians today deal with administrative overload, declining reimbursement, increasing threat of malpractice, and the increasing inability to balance their work and family life. Then add this past year where there's also health risks when we are working as a physician. And although the culture in medicine dictates that we push on through adversity, many physicians find it difficult to cope with these conditions for an extensive period of time. And this is what ultimately is resulting in burnout. Looking after ourselves, tending to our personal needs is not part of a physician's training, and it's typically a low priority. When we feel signs of weakness, to confess that we feel stressed out or exhausted or that we have too much on our plate. Well, if we can't even admit those things, then how are we going to be able to find a balance or find help to try and alleviate some of these burdens? Physicians deal with other people's personal problems all day, but they're the least likely to acknowledge their own problems and stress. So how a physician is going to deal with pressure really determines on how much stress the individual feels and how close to burnout or mental fatigue they're going to get. Mental fatigue is this temporary inability to maintain optimal cognitive performance. And the onset is gradual, and it really depends on an individual's cognitive ability, their level of sleep, and their overall health as to when they'll reach that point of mental fatigue. And mental fatigue also is going to decrease our physical performance. So the Medscape survey that was put out this year was really interesting because it was looking at burnout, as we've talked about, but it took a different twist. This past year, they actually looked at the impact of burnout on the different age groups, looking at millennials, Generation X, and boomers. And what they found was that Generation X physicians report more burnout than other groups. Now, while that might seem like maybe it's something that's inherent to that age group in terms of the coping mechanisms, it may also be that we know that mid-career is typically when we have our highest burnout. And unfortunately, right now, the Generation X is at that midpoint, that mid-career. Women consistently have higher rates of burnout than men over the years. And there's different theories as to why. There was a Harvard Business Review that was published, and one of their theories is, women will take on more work at work. They'll tend to do more of the non-promotable work. And there's more emphasis on collective work for the good of the practice and for their colleagues. And so maybe with that added work, it's bringing on more stress for women, especially as they're balancing home and family, where they might also have more work burden. Now, what are some of the burnout factors that lead to physician burnout? And the factors that have been identified in surveys include too many bureaucratic tasks like charting and paperwork, spending too many hours at work, lack of respect from administrators, employees, colleagues, and staff, and increasing computerization in the practice, these electronic health records. But what's interesting is that the factors that impact burnout actually are a little different based on the age. And so one factor that varies by generation is this electronic health record. And while it is in the top 3 for those that are boomers, it's actually at the lowest for those that are millennials. It's the second to the lowest for factors contributing to burnout. Now, relationships, as you've heard, 2 divorces, it's not, a coincidence. Relationships are going to have a heavy impact from burnout and from the factors that are influencing it. And currently, millennials are reporting greater, emphasis of impact in their relationships from burnout as a consequence. In one survey that was put out by a society for surgeons, of 8,000 surgeons of different subspecialties were polled. And what they found was that burnout was one of the greatest predictors of a surgeon's satisfaction with career and cause of early retirement at any age productivity. And it can have dire personal consequences such as drug and alcohol addiction, sleep disorders, chronic cerebral vascular disease, divorce, and even suicide. Burnout and this depersonalization are really now even recognized as an occupational hazard associated with medical professions. And in one study, internal medicine residents, they found 76% actually demonstrated clear signs of burnout. So apart from the direct mental health impact to the doctor, burnout and depersonalization are also associated with increased rate of medical error, malpractice risk, physician turnover, lack of empathy, and poor patient outcomes. Research suggests physician burnout is a chronic condition, and it can be. And even for those that have a chronic condition, about a third will have recovery fully within 5 to 10 years if they've suffered from severe burnout. So are millennials better equipped to cope with the stressors leading to burnout? Well, millennials are more likely to use sleep and talking with family and friends as coping strategies, while Generation X and boomers are going to use exercise and self-isolation more. We know physicians are more likely to use positive coping mechanisms rather than escape or self-medicating activities to deal with burnout. However, focusing on wellness is not the entire solution. It really requires addressing the problem that's inherent in the structure of our healthcare industry. 49% of all physicians would accept less money in exchange for more free time. And so knowing that, expectations of what a career a physician is going to look like is changing. And that's what's important for you to take home as a message, is what our career, what our profession looks like is changing. That's evolved. Even in the residency where you see the implementation of an 80-hour work week, we are becoming more cognizant of burnout, the impact, and the change is happening. And we realize it's not only in ourselves, it has to be in the structure of our careers. So as you're deciding what career you want to do, one of the important things I want to emphasize to you is you want to look at the different career paths, because you want to start to outline for yourself what might fit best with your professional and personal goals. What's going to help you find that balance? Because there's different career paths that you can think about changing or taking. You also want to consider what are the different demands on the fields in medicine, because some of the fields are going to have a more heavy burden of call, or going to have more intense demands on the physician as opposed to other fields. So one of the greatest pieces of advice I got was that if you like two specialties equally, and even maybe one a little bit less, if one offers you a better lifestyle, pick that one. And so you want to make sure you're taking that into consideration when you're considering what is the career path you want to take and what is the specialty you want to focus on. Now we know, as you've heard, that burnout and the stresses of being a physician can have an impact on our personal relationships. But also keep in mind that people that are unmarried or living alone can actually suffer the highest level of burnout. And so it's really important that you make sure that you are also taking time to invest energy in your personal relationships, because they can be your savior and can help prevent severe burnout. Also, they found in the American Academy of Neurology survey that exercise is extremely important in also helping to prevent the effects of burnout. So do you hold the key, right? Burnout and depersonalization do not occur in every provider. Many continue to find joy, meaning, and satisfaction in their work despite the challenges and stressors. Some doctors possess certain intrinsic human and personality factors, rendering them more resilient. And we know that there are certain personality types that make you more resilient, like a higher score on self-esteem, self-efficacy, locus of control, positive affectivity, optimism, proactive personality, and hardiness. All of these are going to be able to help you better cope with the stressors that we face. Now, keep in mind that physicians' own expectations are often their greatest source of stress. By learning to value themselves, physicians can really recognize that all demands made upon them cannot be met. Essential priorities, really, we have to determine what is important in order to know how to balance, and also for our own survival. So what are some of the preventive measures to consider? Well, we want to improve self-awareness and work-life balance, set healthy boundaries between work and non-work areas. You want to lower stress by learning effective leadership skills. You want to exert control over your work hours. Consider a flexible work schedule. You want to focus on work activities that provide the most meaning to you. And you want to stay aware. Learn more about burnout and prevention. Educate yourself so you can make sure you're recognizing the signs in yourself and know how to treat. And I'm going to just move past this, but know that there is research out there that is showing that if by doing these things, we can make a difference in the incidence of burnout. And that benefit can actually last even out to 12 months beyond the interventions that they implemented in this study. So my survival guide for this, for life and for balancing, find humor in all parts of life. Make time and take that investment in your family and friends, because they can not only help you, but you're helping them as well. Sometimes I feel like there is a certain amount of healthy compartmentalization. You know, when you are home, you want to be present. You want to be there for your children or your spouse. And when you're at work, you want to be there. I often found a car ride was that great way to kind of shift gears between my work mode and my family mode. So I liked a 20, 30-minute car ride home to just kind of turn off work and try to get ready to turn on being a mom. Find ways to decompress, whether that is through exercise, staying active, even at work or at your desk. You want to learn to balance. And it's not a figurative term. You're going to have to make sacrifices to find a balance. It can't all be all work or all family. You're going to have to find some things that you're going to have to give up on. And you're going to have to always keep sight of self-preservation. I talk about finding peace when you're shifting goals. And that shifting goals sometimes has to be from being the best to being your best under the current circumstances. And here's the hardest part that I found. Sometimes our best may not be that good. So we have to learn to prioritize. And most importantly, we have to learn to forgive ourselves when our best isn't the best or when we fail. And with that, I think you can really try and find peace in yourself, and you can find ways to balance being a mom, being a spouse, or however that balance works for you in your personal life. And with that, that concludes my talk.
Thank you, Dr. Novakovic. Thank you for so much information. Goodness gracious. And I know we're at 8 right now, but if y'all don't mind, we'll go for another 30 minutes to answer some questions. So far, we have a lot of love and thank yous in the chat so far for both Dr. Novakovic and Dr. Marchetti for just your honesty about, your journeys and the struggles that you've had. So first, starting for this Q&A, I would like to ask Sava some questions. So Sava, are you there?
Yep, I'm here. Can you see me?
Yeah, I can see you.
All right, perfect.
Perfect. So was it difficult having Dr. Novakovic working in the medical field growing up? Like, was it weird for, her strange work hours? Did that have an impact on you?
You can definitely view it that way. It would seem that it would be difficult, but growing up, that's all I knew because she was a single parent. So I wasn't really used to seeing like another side other than medicine, long hours, but differences started to show up whenever I'd have friends that had stay-at-home parents and I'd see their mom is there all the time while mine's gone. But I wouldn't say that was essentially difficult, but it was just a difference. And I embraced it and enjoyed it rather than kind of regretted or not regretted, but just disliked the fact that she was gone so much. So I wouldn't say it was difficult. It was different, but it was a positive difference that helped contribute to who I am today.
Mm-hmm. Cool. Do you feel like you had to make sacrifices while your mom was working?
Sacrifices, I'd say about the hardest sacrifice I made was not being able to go over to a friend's house because she wasn't able to pick up. She was the one making all the sacrifices for us. Mm-hmm. So it wasn't me that I was worried about. It was her. I was essentially concerned with like how much she was working, whether that was like putting strain, pressure on her, and whether she'd be able to relieve that pressure. So I suppose you could say that was the sacrifice I made. I put myself to the side and worried about her a lot. So that was about the most I sacrificed.
What were some things that Dr. Novakovich did to help you feel supported and loved despite she was so busy?
Yeah, so she did a really great job at this. Thank you, Mom. She made sure that every chance she got, she spent time with us and made sure that we knew she loved us. So on the weekends, she'd take us into work with her. We were able to sit in her office, kind of spend time with her there because that's what she was limited to. In the mornings, she would drive us to school and we'd be able to talk, kind of get all of our mingling in for the day because it wouldn't be until around like 7 or something like that she'd get home. So that definitely helped. Just finding those small moments to spend with us really helped all 3 of us, her children, kind of not be so isolated and alone when a single parent that, is so busy would otherwise put all their effort into working rather than their children. So she did a really nice job with balancing that.
Yeah, that sounds nice. So obviously like that made a positive impact in your life. What do you think in part of your upbringing wasn't the best?
This is hard because I'm the type of person that focuses on the positives in life. So something that maybe wasn't the best was definitely kind of the absence. A lot of the days it would be me trying to be independent, working on, let's say, like homework or something like that, kind of taking it upon myself to figure it out rather than having an outlet to ask and get help from. So that was probably, and that's not like a negative because she was limited. Yeah. It's not like I can blame her. It's not anything like that. It was just one of the downsides of that.
Yeah. And then lastly, do you have any advice for, other kids with medical professionals in their lives?
Yeah, definitely. This is a big one. So your parents or your parent is going to be extremely busy, long hours. They're not going to have a lot of free time, but when they do and they want to spend it with you, make sure that you really enjoy every moment of it. Don't take it for granted. It's quality time, no matter how long it is. And just really make sure that you appreciate what they do. Take pride in what they do. I remember when I was in elementary, I loved to show off that my mom was a doctor. It made me so happy. It was like, look how amazing she is. She's a single parent. She's doing all this for us, and it's affording us a lifestyle where we can live with all these people that only have one parent working. And it was just make sure you appreciate what they do. And that's all I can say. Thank them. It's a hard job.
Yeah, it is. We have so many comments that are saying, this is so wholesome. This is heartwarming. Dr. Novakovich obviously did an amazing job raising you. So thank you for your insight. We have more questions. First for Dr. Marchetti. Do you have any advice for someone who wants to work while they're in med school? I know you kind of were like, don't do it, but we have a couple of people who want to do that. So do you have any advice for managing your time?
Yeah, if you have to do it or you feel like it's something that you really need to do, it's obviously doable. You just have to be almost like crazed, structured and rigid and disciplined with your schedule. So, my schedule didn't really, when I'm working, it didn't allow for studying or family time. And so as long as you realize that you're going to have to make up that time in other ways, I put a lot of investing in me to the side for years. During medical school, there was no, filling my tank or wellness or anything like that. It was, just getting the job done. So, work wasn't bad. It was just stealing time away from other things. And I did enjoy the fact that I had a clinical job and I could put into context what I was learning in the classroom, maybe in a way it did help make me a better doctor, kind of keep my feet grounded.
Mm-hmm. And then another question we have for you. So you mentioned you had like a lot of failures. What advice do you have for students to keep on moving forward despite their failures?
Did I have a choice? You got your goals. You're going to achieve your goals no matter what obstacles are thrown in front of you. So, I never saw it as an option to quit or give up. So yeah, failures come, and I had to work hard on reframing a lot of those into something that I could learn from and move on from. And they definitely all made me who I am today. But you just kind of look at it like, like raising kids, like you don't have a choice to not be successful. You're just going to figure it out. So, failures are inevitable, especially if you're really challenging yourself. So maybe you can have a little bit of comfort knowing that if you're failing a lot, you're really pushing your limits, trying to better yourself.
Yeah, absolutely.
Rachel, is it okay if I add something to that as well?
Yeah.
Because I think in medicine, there's different definitions of failure. And so you can have failures where you didn't accomplish something, but in medicine, failures can translate into complications for patients. And it is going to be a part of life, especially if you're a proceduralist, you're going to have complications. As Dr. Moschetti mentioned, I think the key is to not internalize failures as you failing. It is a life lesson. And so if a complication occurs, the number one thing that you can take away from that is to learn. How can you do better? What could have you done to be more prepared? How can you avoid this type of complication or failure again? So don't internalize failures. That would be my recommendation. Take it as a life lesson and learn how to move beyond it and do better.
Yeah, absolutely. That's great advice. So if you don't mind, we can move on to some of the questions for you, Dr. Novakovic. How did you plan for a family as a woman, and were being pregnant under a stressful condition? Did you have family to support you in your decision?
So I did not have a lot of family support, especially when I moved to Texas. Like Dr. Moschetti, I moved from Chicago to Texas and I had no family here. Even though I didn't have that support, I think, you find support in other ways. So for example, when I was married, my spouse was a great support at that time. When I found myself single, I would hire people that would come in and help, nannies, so we say, that would, be present during working hours and kind of help offset some of the burden on the children as well, so that they didn't feel like, they were being passed along. I wanted them to kind of feel like that things were settled. So even though we don't always have that family infrastructure for support, we can find it in other ways, like ourselves or through the right people that we might hire to come in and help us.
Cool. Another question that was really asked a lot was, when do you think the best time to have kids is? You had them during medical school. Do you recommend for others to have them during medical school, maybe after medical school or before? What do you recommend?
So if I could pick the most ideal time, and this is something that I think I see a lot of the trainees, probably in your last year of your residency is when a lot of people have children. And it's probably, when the rigors of the residency are starting to taper down. You're starting to look at when you're going to start your professional career. And, that you can even kind of build in a little bit of a gap sometimes between the end of your residency and before you start your career. So that is, I think, one of the opportune times where I see a lot of residents doing or planning to have their children. Having children starting medical school is very difficult. I think that, you know, if you are going to have children, it's not to say that you can't do it. You can, but that's where I would highly recommend think about some alternative programs in medical school where maybe you can split that first year in two. It just gives you a little better, you know, work, personal life balance.
Yeah, absolutely.
And I was going to say, and I saw a lot of people having children in their last year of medical school for the same reasons that Dr. Novakovic mentioned for the last year of residency, and that you do tend to have a lot more elective time and freedom. You know, you're interviewing for residency, so you've got kind of a make your own schedule. And it's easy for me to say because I didn't actually carry any of my children. It's a lot more challenging for a female student or a resident. But I saw last year of medical school and last year of residency was probably the most optimal times for my classmates and now my residents.
Agreed. I think I agree too, that those probably are the best times.
So, you know, prior to having kids, you need to have a relationship first with a partner. I'm going to aim this question to Dr. Marchetti first. Do you recommend having a relationship or starting a relationship before medical school, during medical school, or after?
I mean, that's a very personal decision and depends on, you know, I wouldn't just go find somebody to get hitched up with right beforehand. But I can say that doing the first half of medical school married, the second half single, and then going through residency married, that I was much better when I had a partner with me. So, you know, maybe other people that are more challenging to get along with, they may find that actually makes their life harder, and they may prefer being single during going through medical school or residency until they get their professional life together, and then they can go seek out a relationship. But I mean, that's kind of a personal decision, and it really just depends on what your personality is. I don't do well alone.
Dr. Novakovic, do you have anything to add to that?
So I would say that the idea is really to find the right partner and not find a partner at the right time. It is to find the right partner. And so, you know, it took me 10 years being a single mom before I actually found the person that I wanted to share the rest of my life with, and got remarried last 2019. So, you know, I would shift away from the thought of what is the best time. You know, sometimes the best time is when it just happens. And, you know, I think that's part of the key also of being successful, is knowing how to adapt and to be flexible. Some of my pregnancies were a surprise, but, you know, we move on, we find a way to make it work, we keep optimistic, and you just learn, you just keep going if you have that goal. And so if you have a goal that you want to share a life with someone, again, be open to find someone. Don't shut yourself down. Keep yourself balanced, and, you know, get yourself out there. Invest in those types of relationships, but don't rush. Wait till you find the right person.
Oh, cute. Sorry. So going back to pregnancy, actually, a lot of students are asking, what was maternity leave like? Did you find it was there was any impact on your workplace because you had to take time off?
So that is a really good question. Again, I had 2 pregnancies in 1 residency. With the way that I structured the first pregnancy was I had only 4 weeks off. So we very carefully tried to block my vacation time, which was 4 weeks, for about when I was going to deliver. And it just kind of all worked out. On the second pregnancy during residency, that was different because I went into preterm labor and I had to have extra time off. So in the end, I had to extend my residency by 1 month. to kind of meet for some of the time that I lost. But there is a way to coordinate it with, your vacation time, so that you're not actually losing time, but you do have to recognize that you're only going to have like 4 weeks off if you do that.
Yeah, cool. I'm glad like you could work out maternity leave with your residency. Sounds like it was a very good residency. Another question that we had was, is it better to have a partner in medicine, or is it better to have a partner not in medicine? I think Dr. Morchetti, your partner, Mrs. Morchetti, is not in medicine, correct?
Right. Now she's got a degree in biochemistry and was thinking medical field, but she worked in the lab and at Starbucks when we first met. And then when we moved here, she actually became a high school chemistry teacher. So, there is something to be said. I have a lot of friends who are married to other physicians, and there's something to be said for having someone that understands a bit more about what you're going through, and you can relate easier to each other. But to be honest, like I enjoy not having to talk about work stuff with my wife, and we can talk about any other thing. I just don't have to talk about medicine. Now, I mean, she's curious about, how work was, but I guess those who have medical field partners, they probably, for the same reasons I enjoy my prose, they enjoy their prose.
Dr. Novakovich, do you have anything to add to that?
Yeah, so, my first marriage, my husband was not a physician. And now my second marriage, my husband is a physician, and we actually work together. And so, again, it's different for each person, for the individual and for the relationship. I think one of the beauties about my relationship now is we work together. So it kind of solves some of the problem of, how do you find time for each other when we work every day together. So, where maybe that's not a benefit for some, it's really been, a blessing for us and allowed us really to grow our relationship. I think, there is, Dr. Morchetti pointed out, sometimes, there are times where it's easy to talk to someone who's a physician about some of the stressors that you feel. But then at the same time, having someone who's not in medicine can also be a great distraction, because they have, other things that they're going to talk about that you're going to find interesting and fascinating. And it's a little bit maybe out of your world, so to say. So I think there's pluses and minuses to both. You're just going to have to really base it on the individual that you find. And again, that person being the right fit for you, regardless of their background.
Yeah, absolutely. Another question that we had is, on average, how, I'm gonna direct it to Dr. Novakovich first and then ask Dr. Morchetti to add on to it. But on average, how often do you take your work home with you? And like for how long do you take work home with you?
All the time. So, and that is, again, one of those areas where I said, I'm not always perfect. I make mistakes too. There's an unlimited amount of demands on your time as a physician. I often feel like there is no way to complete all the tasks. It is a process. It's a journey. It is not a destination to complete all of your work. And so, while maybe you're going to make that sacrifice tonight to do a little bit of work, you're going to make it up on another night where you're going to maybe go home a little bit early. And I think that's the balance. It is, you just have to kind of find how you are going to balance it. And, I may not always be successful at it, finding the right balance because the work is so much. But again, sometimes you just have to learn to put it down and say, this is going to be turned in late.
Yeah, and I'll echo that and add that COVID has even made it worse, because it's even worse work-life balance. At least before, when I'd come home, people would be like, oh, he's home, let's leave him alone. But now, because most of my work, in EMS. I only do about 4 or 5 clinical shifts a month now in the ER. Most of my time is running the EMS system, and that's a lot of administrative tasks, quality management, teaching, case reviews, things like that. And so I wake up in the morning and, we'll play with the girls and breakfast. I'll get my cup of coffee. I'll make the long commute down the hallway to my office. And there's no boundaries anymore with COVID. And, Dr. Novakovic is right. I don't actually complete my work. It's one crisis after another. And then at some point between about 7 and midnight every night, I just decide I've had enough for today and unplug from the matrix and, go decompress. I miss that drive time. I also have about a 30-minute drive when I go back into work that I do decompress, but I don't have that when I'm working from home. So, it's not always going to be like this. We'll get those boundaries back. But pre-COVID, for about every 50 hours I would do at work, I'd have 10 to 15 hours to do at home. It's much worse now.
Oh, no. Well, last question. I will ask for both of y'all, and I will aim it for Dr. Morchetti first, and then I ask it to Dr. Novakovic. What is the biggest, most inspiring thing that has helped y'all power through your struggles? Because y'all have both had struggles to get to where you are today. Dr. Morchetti?
Yeah, I'm thinking. I do find reward in my work. I like the idea that I think what keeps me going and inspired is feeling like I'm making a difference in my community. As an ER doc, I walk into the ER, I walk into one room, I see one patient, I treat one patient, I help one patient. But now my role with public health and EMS, I train 5,000 paramedics, and then they go out and treat hundreds, if not thousands of patients. And I feel like I can amplify my effects in the community. And so to me, that's the inspiring part that keeps me going. I can't think of one single event to hang my hat on.
Dr. Novakovic?
So I have to agree. I think the things that inspire me, number one, I love my job every day, even though it's demanding, even though, you face an unlimited amount of work that you can not accomplish everything. I love it. I love what I do. You have the ability to have an impact for a patient, for a family, to help them. The other inspiration is my children. I couldn't have found a better balance to how busy work was than to have the joy of coming home and spending time with them. It's challenging, but I think that the rewards in the investment of having children and relationships like your partners, those are all the rewards that have made all of it worthwhile.
Fantastic. That was an absolutely beautiful last little tidbit to include. Thank you all so much. Thank you, Dr. Morchetti, Mrs. Morchetti, Dr. Novakovic, Sava, and, our bonus Morchettis for your talk tonight. It was so wholesome. Everyone is absolutely in love with you guys and your family. And thank you for giving a beautiful perspective and a realistic perspective on what it's like to balance career and family. And everyone is giving wonderful thank yous tonight. So if you want to read the chat, you can. Everyone who's still here with us, thank you for joining us.
And Rachel, thanks for hosting and organizing. I appreciate it.
Yeah, thank you so much for having us.
All right, guys, y'all take care. Have a good night. See you Tuesday night.
Yeah, Tuesday night. Good night.